So for laser hair removal, it is a series of treatments. This is, again, not a one and done type procedure. Depending on the area, we're treating patients every 4 to 6 weeks or every 6 to 8 weeks. So we're looking at about a year to year and a half of hair removal. Patients that are the best candidates have very light colored skin and very dark, coarse hair. So after we've done, we usually recommend 8 treatments for our patients. After we've done the 8 treatments, especially if the patients initially had very coarse hair, we were easily able to treat. We expect about somewhere between 90 to 99% hair reduction. There are some patients who either have more lightly colored hair, although it is treatable with laser hair removal, there's not the same target in terms of pigment, but also if the hair is very fine, some of those patients may require follow-up treatments. So what we'll often see is we have our patients come in for their initial 8 treatments. Occasionally, we will recommend them to come back and receive follow-up treatments, but the average person, we expect about 90 to 99% hair reduction with the initial 8 treatments, but again, there are outliers. Other outliers, also any sort of hormonal fluctuations, so pregnancy, menopause, hormone replacement therapy. Those are the main things that we see. Also women with a condition called polycystic ovarian syndrome. Anything that's going to fluctuate your hormones can change the hair growth and the hair growth cycle. Those patients may also need continual touch-ups. So in that case where we would see a patient who maybe had less hair reduction than what they would expect, again, we may just require more treatments. We have never seen an incident where the patient stopped and then their hair growth was what we call paradoxical, where they had an increase of hair growth after the treatment. That's one of the reasons we recommend going to a physician-owned and operated medical spa, where we keep close eye on the patient, the settings. We don't want the settings too low to where we can stimulate hair growth, but we also don't want the settings too high where the patient may have compromised skin in terms of burning or skin breakdown. Every year, our technology is improving. The 2 lasers that we have here at Plaza Aesthetics and Wellness are very well tolerated. The reason is the cooling probe. The laser is applied to the skin, it cools down the skin, and then it fires the laser, which is like a small rubber band snap. We have never had a patient that came in, said this was too painful, and they were unable to continue treatment. I guess that's always a possibility, but this is very well tolerated. On a pain scale, 0 to 10, 10 being most excruciating pain, 0 being no pain. For some patients with very good pain tolerance, 1 or 2, maybe poor pain tolerance, potentially a 3 or a 4, but this is not an excruciating experience.